Assalamu alaikum. I'm happy to be with you today, and I thank Professor Hisham Awad, Professor Adil Riyad, and Professor Muhammad al-Barbari, my dear friends, who invited me to have this opportunity with you. Then the talk will be evaluation of a stool or looking at the book. We can comment on color, consistency, odor, contents, mucus, blood, or parasites of the stool. Considering the color, the only thing that is correct in the poo emoji is the description of the brown coloring. And stercophylline coming in the stool is the explanation of the color of the stool. And you know all that stercophylline is coming from stercopylinogen that comes from the bilirubin excreted in the stool. So the color may be green. And this green stool means that more stercopylinogen is coming in the stool due to hurried large intestinal peristalsis. Keep in your mind that some dietary factors may be implemented. So green leafy vegetables may give you the green color of the stool. Green coloring agents such that in the flavored drink mixes or ice pops. And sometimes iron supplements may lead to this green stool. The light-colored, white or clay-colored stool is a serious finding because usually this is a sign of bile duct obstruction. Of whatever the cause of this obstruction, this sign is very important and should alert you to this possibility. However, large doses of bismuth subsalicylate, kaolin or pectin may give you this color when used in the treatment of diarrheal disorders. If it is greasy, foul smelling, this means that fat is excess in this stool, and it usually reflects a state of maldigestion or malabsorption. However, excess protein in diet may be the cause of such a condition. If you find that the wall of the toilet is stained and its washing is very difficult, this is a sign again of this fat maldigestion or fat malabsorption, which may range from a pancreatic disorder, hepatic disorder, or intestinal malabsorptive disorder. And whether it is congenital disorder or acquired one may direct you to the underlying cause of this disorder. A black stool is very important, and if it is tarry, sometimes offensive, may give you the clue to an upper GI tract bleeding. Sometimes a black stool may reflect iron supplements, bismuth subsalicylate, black licorice. And in these conditions, stool is normal in consistency or even hard. A bright red stool reflects a lower GI bleeding. But take care, take a history of red food coloring like beets, cranberries, tomatoes, or soups, red gelatin, or drink mixes. And if you look at this tarry-like black stool, you can describe melena, and you should find a cause for this. This patient came to me complaining that he has got black stool for which she exposed her child for 3 times endoscopy and 5 times upper GI series to find out a cause of the bleeding. And all of physicians missed to see the stool. This dark green stool, and you can find the greenish color at the margin of the stool. And if it is not present, please put it on the white paper, spread it into a thin layer, then the green color will appear. And all these investigations were not indicated, were not needed, so they are harmful. And if you looked at this color of the stool, it may be a fallacious color, or it may reflect a maroon color that usually comes from the small intestine. One of the causes of this is Meckel's diverticulum. However, this bright red stool usually reflects a lower GI active bleeding. Clay-colored stool, again, is one of the major important signs that you can look at. If you don't look at the stool of a jaundiced infant, newborn infant, you may miss this serious condition. What is this? This is some streaks or spots of blood with mucus. And actually, mucoid bloody stool may reflect some sort of allergy in young girls, may reflect an inflammatory process like inflammatory bowel disease in older children. And here, some streaks of blood, even if they are minute, should be considered as important finding. It may reflect an infection with active dysentery. So try to take history to find out what's going on. And in this red currant jelly stool, you can guess the possibility of an intussusception. The consistency of stool will vary. So they have proposed the Bristol stool chart, although some of the consistency of some stool you see will not fit in one of these categories, but it is a major classification that can guide you. If they are having these separate hard lumps, like nuts, and hard to pass with straining, this is type 1 reflecting some sort of constipation. And actually it varies from one to another, from a large bowl to a small ones. And actually this is the severest form of constipation. Sometimes they coalesce together and form this sausage-shaped mass that is formed of small lumps adherent together. This is type 1, type 2 constipation. Sometimes the sausage shaped is there and it is hard but not formed of different exact lumps but have cracks inside. And this is another form of constipation. If you have this sausage shaped snake-like that is smooth and soft and passing easily, this is a normal one. And if it is from soft blobs, clear-cut edges that are easy to pass, you can take it as normal as well. When it is fluffy with ragged edges and fragmented, floating on the at the toilet, on the water, this is an early diarrheal pathology. When it is liquid water with no solid pieces inside, entirely liquid, this is a severe form of diarrhea. And these are fluffy stool floating on the water, staining the water itself. This is an early form of loose stool. Sometimes if you can find something adherent or sticky at the wall of the toilet, you can think in a fat maldigestion as well. The odor of the stool is usually there. It's an odorless material. However, sometimes it is more abnormal. If it is offensive, like spoiled eggs, you should think in the possibility of fermentation, infection, small bowel bacterial overgrowth, pancreatic insufficiency disorder, celiac disease may be there. But the most common cause of offensive stool for a longer duration is small bowel bacterial overgrowth. If it is like acetic acid or acidic in general, you should think in carbohydrate maldigestion disorders or malabsorption disorders. If you found the mucus, you should differentiate between two categories: respiratory cause or gastrointestinal mucus. The most important source of mucus in the gastrointestinal tract is the colon. And usually this mucus is produced after formation of the stool in the right colon. So when it comes like sheets or covering the stool as whole, you are confronted with the colonic cause of mucus. And if it is particulated greenish stool that is covered with some mucus around each particle, والأم هتقول مخرز أو محبب. Usually this is a respiratory cause because mucus is coming from above before formation of the stool, and it will entangle part of the food inside, and it will come like this, مخرز أو محبب. Again, blood may be melena, maroon, and the bright red blood, and we discussed this before. Sometimes you can see, or the mother can bring the stool to you with its parasites. It may be enteropiasis, it may be ascaris, it may be larvae. Very common to come with us showing you the diaper having this larvae, and you can differentiate it from the parasites by having more legs inside. And the most common cause of larvae is uncleanness of this child. So some of the mosquito of the flies will put their eggs in the nose or mouth, and they will hatch, giving this, or eating some unclean food will be the source of this larvae in the stool. And it does not need treatment, it just need to have clean food, clean child. And you may find this stool with this small parasites inside, and this is the Enteropius vermicularis inside. And our colleagues doing colonoscopies will see these worms moving and wandering in the colon. In the morning, it's usually seen in the cecum. And if you are doing your endoscopy near night or midnight, you can find them in the rectum. And this journey is very related to the clinical presentation. So when they are moving at night to the anal opening, wandering there, they are the cause of itch. And actually, if you have this itch of the anal canal happening only at night or during sleep, it's usually Enteropius vermicularis that you can treat without having the stool analysis or even the adhesive tape analysis of the perianal swab. And if it is having this itch of the anal canal happening all through the day and night, usually the cause is maldigestion with fermentation and irritation of the anal canal by the acid produced. And this is another picture showing no stool, but the ascaris are coming in this very huge number from the anal opening. You can see in some cases tissue threads, and the mother will bring the stool to you having not mucus, but separated parts of the mucous membrane tissues inside the stool. And usually this reflects a severe inflammatory pathology, the most common of which is antibiotic-associated colitis. And if it is more chronic, we can think in inflammatory bowel disease. Foreign bodies can be found in the stool, and many times the mother will find missed things in the stool of their kids. Hair in the stool is not uncommon, found in the stool of young infants and in children when they are having this trichotillomania or this hysterical or psychological behavior of pulling on the hairs and putting there in their mouth. Sometimes I have seen a very small toothbrush coming in the stool of a young child. So many things can the poo tell you. So please look at the poo. Describe adequately, but please do not overinterpret, because an overlap between normal and abnormal may exist, and do not stick to one possibility when you find this abnormality. Widen your scope, have your own algorithmic approach for each finding, and do not be delayed to refer when a serious finding is there. Thank you.